Salman Khan, 2007 he did FUT surgery and one more strip surgery in 2010 mostly. Akshay Kumar also had a strip surgery, and again the frontal hairline with the strip surgery looks perfectly natural as well as sustainable.
2 strip surgeries and you are comfortably okay?
Yes, I'm totally fine.
And no neck rigidity? Can you move your neck properly?
Today we will be busting some views about FUT, because people are really having misinformation about FUT. The advantages were never been told and disadvantages have been over highlighted. The reason behind that is mostly the incapabilities of doctors or the clinics which cannot provide FUT option, and they tend to give misinformation to the patient, a notion that FUT is a outdated procedure or it's not actually a good technique nowadays, and threaten them that it can lead to disasters like neck tightness, infection, complications, sometimes cancers. So I keep on giving live examples of my old patients in which we have done 2 sessions. Mr. Naveen, he had a transplant with us 4 years back with a strip surgery, and again last year in 2023 second strip surgery was done. So 2 strip surgeries and complication free. So that is the thing which gives confidence to us also and our future patients also, that strip can be done comfortably without any complication. Hello Naveen ji, how are you?
Hi, thank you.
So glad you are here and you can share your experience about 2 strip surgeries. So to start with, 2020 you are almost grade 6 bald, like front, mid, scalp and vertex, right? So that time, were you hopeful that it can be covered in your any lifetime?
No. I just came with a little hope that maybe something can be done and I don't need to wear my cap. That's it. That time was.
Yeah. So when we did your first surgery, because strip was again a blockage in patient's mind, that lot of doctors have told you that strip is an outdated technique and it might lead to complications.
Yes.
So have you met different doctors and their opinion was same?
Yeah, of course. I mean, coming here before that, I met a lot of doctors I've gone through, and majority was like into going for FUE. But when I met you, I realized no, FUE won't serve my purpose because I need a lot of hairs, and FUD can help me in that only thing. And you're doing the combination of both, so I was very hopeful. I became hopeful and came here only.
Yeah. So how was the first surgical outcome during surgery and post surgery?
So it's like just. Of course, it's like a surgical thing, so you need to follow protocols of that. But after a couple of months, I was like normal and I was happy to go out. And within some time, like a lot of people who I met after some time was not able to. Okay, who are you for a second?
Is it?
Yeah.
And what about the complication which doctors have maybe enumerated, like neck tightness will be there, there might be some scarring, major scarring, or complications like infection or some, you can't do your exercise and all?
Initially, of course, you feel some slight oppression this year, but after a couple of months, you don't feel anything.
Absolutely normal, you can do all exercise.
Yeah, right. Even I went to gym also for some time. Normally, I'm not a gym guy, but I went, but nothing happened.
That was absolutely okay.
Yeah.
So most of the time when we have a grade 6 baldness, we need lot of hair to cover all these area. In these conditions, when we utilize a small donor area just by FUE technique, the density keep on going down. In that case, we have to utilize on top of FUE strip surgery, the FUT, which utilizes the centralmost portion, and with microscopic dissection we can get more graft from a smaller area. And combining with FUE and body hair, we can extract maybe up to 5,000 grafts, which we did in the first session. We covered the frontal area, mid scalp, and little bit for a vertex also. So beautifully designed the frontal hairline that gives a natural look to you.
Yes, you can see, I mean, it's very normal look now.
So after first surgery, he came back after 3 years with completely healed and normal scalp, like the back was not much depleted, elasticity was regained, and we can redo one more strip in 2023, that last year. So second strip surgery, was the thing more complicated, like or it was like the similar the first one and the healing was okay, there was neck rigidity?
It was more or less same. I ended up more easier because I know what I have to go through, so psychologically also I was ready and it went more smoother than first one, I can say that.
Good. So second surgery, strip surgery, still normal and absolutely okay.
Yeah, after 1 year you can see I'm normal, nothing is like.
So greatest advantage was 2 strip surgeries, some FUE, some body hair. We extracted again the second time almost 4,000 plus grafts. So in total 9,000 grafts extracted, and mostly from the back of the scalp. Still, if you see the donor area, there is not much of density depletion, elasticity is regained, no measure of scarring on backside, and he can still do all type of exercises. Any neck rigidity or tightness, no. Even after 2 surgery, you are comfortably physically okay.
Yeah.
Yes. Some people have told you that there is a non-surgical option is available, that is FUE, which is absolutely false. FUE is also a similar surgery. It involves similar depth of incision, almost 4 mm like FUT. Best part is with FUT, we involve the centralmost portion, which has the longest life of hair, isn't it? Because the centralmost hair has the longest life in your lifetime. So if they are shifted in front, they will give you the longest life of transplanted hair, and that's what happened. And we have some celebrities which have done strip surgeries, like Salman Khan, 2007 he did FUT surgery, and one more strip surgery in 2010 mostly. So with 2 strip surgeries, still frontal hair transplant is going very well. So almost 14 years since then, and strip surgeries does longest survival of hair. So we have more examples like Akshay Kumar ji. Akshay Kumar also had a strip surgery, and again the frontal hairline with the strip surgery looks perfectly natural as well as sustainable. So long-term sustainable results are possible with strip surgery, because the central area of harvest, the longest survival hair is possible with the centralmost part of the donor area. If we do only FUE, like 5,000 grafts from back of the scalp, and it looks absolutely devastating. Everything like density goes down, lot of scarring in backside, and that's why this 5,000 grafts even not sufficient to cover all of the scalp. So you have to live your life with less number of grafts, empty areas, and donor also depleted. So it's like you stuck in the midway if you go for only FUE technique to cover higher grade of baldness, grade 6 or grade 7 baldness. So always combination gives a better outcome, and obviously designing is the key for happier outcome, isn't it?
Yes. It's not natural.
Yeah. So how does the naturality plays the role in the overall happiness or the confidence building?
It's like if you go somewhere, nobody notices that this is a transplanted hair, or maybe something is done in the hair. Just feel normal, and you also feel more comfortable in your own skin then.
Yeah. So you tend to forget about transplant and live a normal life.
Right. Totally.
And if it is noticeable transplant, people used to stare sometimes on your hairline, and that makes you very uncomfortable, right? Isn't it? Yeah. So it's more of an artwork to do a natural hairline design, because every face is different. Proportions are different, so curvatures are different, and requirement of baldness coverage is different, the thickness of hair is different. So we have to design individually for different patients how the hairline should go so that it should look natural to the face, and the age appropriate outcome should be there. It should be non-noticeable transplant. That is the key for a successful outcome. So it is more of an artwork. So I precisely do that artistic work myself, because I do a lot of art and sculptures work. So frontal hairline with single hair graft in a zigzag pattern, a central widow's peak. If you notice your central point, there is dipping in the central point, which gives more aesthetic appearance, isn't it? So overall, it's a balanced hairline and non-noticeable, which gives the ultimate output of looking natural. A lot of your friends must be motivated after seeing you.
Yeah, of course. Who knows me from last before that, they know and they want to do. In fact, a lot of people are losing hair now, so they want to come. Yeah, I already recommended you name to them.
Thank you very much, and hopefully I would like to see you again and again with good sustainable hair, and keep in touch so that we can guide you for the management if needed.
So thank you.
Thank you.
For more information, go to our YouTube links. We have detailed information of this subject on my YouTube videos.